Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the comprehensive evaluation and successful treatment of chronic thyroid conditions which have not responded to traditional medical care. Today we're going to be talking about secret number 6 in our continuing series of DVDs, where we talk to you about all the different things that can go wrong with thyroid metabolism and what we can specifically do to help get you better. So today we're going to be talking about the important interaction between the thyroid gland and the pituitary gland. So in the body, you have something called the hypothalamus. And the hypothalamus is deep in the brain, and what it does is it will regulate your production of pituitary and thyroid hormones. So it senses the level of thyroid hormone, and what it will do when it senses the thyroid hormones are low in the bloodstream is it will stimulate the pituitary gland to make something called TSH, which is thyroid stimulating hormone, and that will cause the thyroid gland to actually make the thyroid hormone, and eventually that thyroid hormone is going to move through the bloodstream and it's going to get into cells so that cellular metabolism can occur. Now, what often is overlooked in thyroid patients and those that have thyroid symptoms is that the pituitary gland can be the reason why your thyroid gland isn't working, and this is often and almost never looked at in the traditional medical practice. Now, how you would know that the pituitary gland is underactive is you would look at your TSH level. Now, we talked about the importance of using the functional range for thyroid stimulating hormone, which is 1.8 to 3.0. Now, if you are under 1.8, that is going to indicate that your pituitary gland is not stimulating your thyroid gland appropriately. Now, if it's very low, like 0.3, that would indicate that you're in a hyperthyroid state, and we'd have to deal with that with our autoimmune protocol. That's what's considered Graves' disease. It's an autoimmune condition, and we would use our autoimmune protocol to address that. Now let's talk about what would cause the pituitary gland to become sluggish. There's several things. Probably the most common is going to be adrenal gland dysfunction. We talked about that on the secret number 5. And what happens is that typically you get a high cortisol production in the body, and that high cortisol is going to suppress pituitary gland function. Something else that I also do that is blood sugar imbalances, chronic infections. Those are some common things. Now, we would also find these things with our whole comprehensive protocol. So whether it was a adrenal gland problem, blood sugar, we would find that based on the various tests that we would do. Now, also pregnancy. Pregnancy can be very hard on a woman's body, and so that also could be something that would cause suppression of the pituitary gland. Now, also the pituitary gland is very important for hormone production as far as your ovaries go. Your pituitary gland secretes something called follicle stimulating hormone, and also secrete something called luteinizing hormone. And those hormones are necessary for you to be able to conceive. They stimulate your egg, and they allow for proper environment so that once the egg is fertilized, they can stay and it can grow into a fetus. Now, also something else that can occur is that if you have high blood sugar or insulin resistance, what will happen is that will cause your hormones to shift from making estrogen to testosterone. Now, when you have high testosterone, what that's going to do is that's going to cause you to have male characteristics like broad shoulders, you may get facial hair, and this is something called polycystic ovarian syndrome, or PCOS. So whether you have a sluggish pituitary gland or have PCOS, we would be a good office to consult with us, because we know what to do to cause those metabolism issues to be addressed, and we would do that with our all-natural protocols with supplementation and lifestyle changes. So our secret number 6 has to do with the pituitary gland and its importance on thyroid function and your ability to have fertility, ability to become pregnant, and also how it can affect your issues with what's called PCOS. So if you have any of those conditions, that we would be a very highly qualified office to be able to handle that. And so if you are sick and tired of being sick and tired, what I'm going to recommend that you do is give our office a call and consult a doctor who knows what to do to help you with your chronic thyroid issues. Give our office a call at 425-821-1101 and you get 2 free visits. Now next time we're going to be talking a little bit more about hormones and how shifts in hormones can also cause the thyroid metabolism to start having problems. So that's what we're going to talk about. That'll be secret number 7. See you next time.